Heard both Chiquita and Sarah give you an overview of what's going on in a bunch of different places. Excuse me. Now we're going to hear a little closer to the ground what is going on in two very specific places. And specifically, we're talking about the states of Arkansas and Maryland. We're going to start with Maryland with Rebecca Pearce, who's the executive director of the Maryland Health Benefit Exchange. She's been that for almost 3 years, which is pretty remarkable when you think about the length of existence of the Affordable Care Act itself. Before that, she held a number of senior national positions with Kaiser Permanente. Now, Maryland is one of those states Sarah Dash was describing, opting to run its own exchange, and Rebecca's here to give us a frontline report on how things are shaping up in Baltimore and Annapolis.
Great, thank you. I appreciate the opportunity to be here. Thank you very much. I want to start with a couple basics about Maryland. I was hired very early on because the governor signed an executive order the day after the Affordable Care Act was signed. So Governor O'Malley has always been behind healthcare reform in the state and very quickly put a commission together to determine exactly how the state should move forward with healthcare reform. The exchange was implemented and created in our first set of legislation in 2011. We've been able to pass 3 sets of legislation so far to really make sure that the marketplace that we're putting in place is actually right for all Marylanders. So we did it in incremental steps. Our population, we have about 5.9 million people in the state. We have about 800,000 who are uninsured and about 590,000 who are eligible for Medicaid or in the exchange. But why does Maryland care about this? Hilltop Institute out of University of Maryland, Baltimore County did an economic impact study for us. And what they determined is that the Affordable Care Act creates 9,000 new jobs in the state in 2014 and 26,000 new jobs in the state by 2020. So we very much believe that this is a jobs creation piece, not only just about healthcare, but down the path. And not only that, it infuses $600 million in federal subsidies into our state in just 2015. So very important to us. This slide shows what our expected new enrollment is. So really, if you focus on 2014, we expect about 250,000 people to be enrolled through Maryland Health Connection in the first year. We expect by 2020 to have about 475,000. You can see that lowers our uninsured rate by about half by 2020. So again, very important to us because we really think we can make a difference in the uninsured numbers. The line at the bottom is a little bit difficult to see, but really what this drives home is the importance of the system that we're putting in place. The Affordable Care Act allowed us the opportunity to replace a 20-year-old enrollment and eligibility system for Medicaid. And so while we expect about 250,000 people to enroll through Maryland Health Connection in year 1, once all of the redeterminations are made for all of the 800,000 people who are currently on Medicaid through our new system, it's going to be over 1.2 million people who are on our new combined system. So it's, again, very important to us. Talking about our plan availability, we had 79 medical plans that were approved by the insurance commissioner several weeks back. We recently received notification that Aetna and Coventry were exiting the individual market in Maryland as they are in many other states. That leaves us with 59 medical plans available. And even though we didn't require people to have a platinum or a catastrophic plan, we did require the gold, silver, and bronze. You can see that we have at least 5 plans or several plans. I guess the catastrophic has 3 plans. We have plans at every single metal level from multiple carriers. So we're very excited about the flexibility that we'll be able to offer, and we really feel strongly that anybody searching will find a plan that's right for them. From a rates perspective, I don't think we were up in the rates information. Our rates were just released very recently. We did an analysis, and we determined in that analysis that of the other plans, of the 12 states that had proposed or approved rates, we were actually among the lowest. New Mexico had one plan that was actually more expensive than ours by $4. In the Baltimore metropolitan area, the average rate for a 25-year-old non-smoker is $167. A 50-year-old non-smoker is $360. Just for reference purposes, you can see the DC rates there is slightly more expensive. But again, we feel like the number of plans and the rates that we have on our market are really going to be competitive. But how do you actually get people to come? So we're going to build it. We've been building it for the past couple of years, but how do you get people to come and purchase? So we are going to utilize as many people as possible. Our last estimate is that we have about over 5,000 people who are going to be supporting us. We have our connector entities are separated by region, and we are going to have over 200 navigators with 300 in-person assisters. These are the people who are really going to be out knocking on doors. We are utilizing our local departments of health and social services. We have over 2,500 caseworkers who already do Medicaid eligibility in the state, so we'll be utilizing them as well. And then brokers in the market. We have over 2,000 brokers who have told us that they intend to work with us. And so we have over 950 of them already set up for training, signed up for training that starts in mid-August. And so between those, there's about 5,000 people. It doesn't count the call center. We're going to have 125 people at the call center as well, because we know there are going to be a lot of touches for this. We expect people to want to talk to somebody, not just sit at the internet and fill this out, but to be able to really talk to somebody who can explain things to them. So this is how we split up the state from a regional connector entity perspective. It was very important for us that, and we call them connector entities, these are the navigators and the in-person assisters. It was very important to us for people to understand, for those connector entities to be so local within their environment, to work with the community-based organizations, to reach the underserved population, to the hard-to-reach population. And when they submitted their grants to us, they had to prove to us that they could reach these populations, that they came with, there are 6 connector entities that are working with over 50 smaller organizations within the state who have expertise reaching specific pockets of the population. We do have several online resources. We do have marylandhealthconnection.gov. It is up. This is our portal. This is where everybody's going to go to enroll. It's a placeholder page right now, several pages. It's got a calculator on it and things like that. But come October 1st, it will be where everybody goes to enroll. We currently also have marylandhbe.com. This is our stakeholder site. This is where you can actually sign up for a weekly newsletter that we send out, and is really the hotbed of information of what we're doing right now. And talking about our marketing piece, we are again, how we're going to get people here. We just launched our social networking pieces last week. You can follow us on Facebook and on Twitter. We'll also be on YouTube. But this is just the beginning of what will be a very comprehensive marketing and outreach campaign. We will be full-blown in the market as of September, at the very beginning of September, really doing some education pieces in the beginning to just educate people about the importance of and the value of health insurance and the importance of having health insurance, and then moving to the call to action really a little bit later, starting October 1. So that's the very quick snapshot of where we stand.
Quite a good one. Thank you very much, Rebecca.